This presentation, Case Finding, is sponsored by the National Cancer Registrars Association Education Foundation. During this presentation, we'll define what case finding is, methods of case finding, and why it's important. Case finding is a system for locating every patient, inpatient or outpatient, who is diagnosed and or treated with a reportable diagnosis. All registries must perform case finding. Although registries may use different source documents, the procedures involved in case finding are similar. Almost all malignant cancer cases must be reported to the state. A couple of malignant cancers that are not reportable are squamous cells and basal cell cancer of the skin. Some benign central nervous system tumors, including brain tumors, are required by law to be reported. A hospital cancer committee or some central cancer registries may require the registry to report other benign, borderline, and uncertain behavior cases. Examples include carcinoid tumors of the appendix and borderline ovarian tumors. There are two types of case finding methods used by registries, active and passive. Active case finding involves registry personnel retrieving source documents such as a pathology report or radiation oncology reports. The benefit of active case finding is that this method is more thorough and accurate than passive case finding. Registry personnel have knowledge of criteria and terminology to recognize reportable cases. Passive case finding occurs when other departments notify the registrar of potential reportable cases. A concern with passive case finding is that non-registry staff are not as familiar with reporting criteria and terminology, so potential cases may be missed and incomplete case finding may occur. Most registries use a combination of active and passive case finding. Various sources are used for case finding. The main source is pathology, which includes surgical pathology, biopsy, cytology, bone marrow, and autopsy reports. For radiation oncology, treatment summaries and new patient listings are valuable sources for case finding. Surgery schedules and reports can be used to identify port placements or seed implants for prostate cancer. Logs from cancer-specific outpatient areas or clinics, such as chemotherapy clinics, are important to include in case-finding procedures. The computerized disease index, based on cancer codes, is another main source of case finding. Inpatient chemotherapy and clinically diagnosed cases by radiology are some of the cases found using the disease index. Cancer registrars rely on coders to accurately code hospital encounters to find these less obvious reportable cases. Case finding is necessary to ensure complete reporting. Cancer registries use many quality control procedures to guarantee all cases are captured and reported. Completeness logs can help monitor the number of cases found. Multiple completeness logs can be used to identify, for example, the number of cases by month and department, by month and year, or by year and cancer site. Comparing different monthly or annual reports can identify unreported areas so that immediate corrections can be made. Case finding is a system to locate all patients with a reportable tumor diagnosis. Cancer registrars utilize many sources to make sure that all cases are reported. Thank you. This presentation is brought to you by the National Cancer Registrars Association Education Foundation. For more information on the Education Foundation, go to www.ncraeducationfoundation.org. For more information on the cancer registry profession, go to the NCRA website at www.ncra-usa.org.